Hello, and thank you for tuning in to our Facebook Live Q&A about COVID-19. Today, I'm joined by UI Hospitals and Clinics Chief Medical Officer, Dr. Teresa Brennan, who will give us an update on the state of the pandemic and answer questions about our response to the latest surge, provide recommendations for the holidays, and more. Please submit any questions or concerns you have, and we'll answer as many of them as we can throughout our discussion. Before we begin, I want to note that this video is for informational purposes only. So if you feel sick or you're concerned about your health, please contact your primary care provider or schedule a video visit to speak to a provider. Thanks for joining us today, Dr. Brennan.
You bet. Happy to be here.
The state of the COVID-19 pandemic is changing so quickly. Where do things stand locally and statewide right now?
Yeah, we're in a tough situation. The numbers have been going up over the last couple of weeks to numbers that we had hoped we'd never see. Right now we have over 90 patients in our hospital, and all of the area hospitals we've had good communications with, and they are really busy and either full or nearing full. From a statewide standpoint, the numbers of hospitalizations continue to go up, and we're almost at 1,400 people in Iowa in the hospital, with nearly 300 of those patients in ICUs. So it's stressing the capacity of our healthcare system, and the prevalence in the community makes it so that we're all at risk if we don't follow the safety standards that we've been practicing.
Yeah, I can't help but think back to the very beginning of the pandemic when you and I were doing one of our very first Facebook Lives together, and you said to me, "Don't fear the virus, respect it." Do you feel like at this point people are respecting the virus?
Yeah, that seems like a long time ago, doesn't it? Just 6 short months ago or so, or 8, I can't count. No, I think we've gotten complacent. I think all of us have opportunity to be better. I think we're tired. The average citizen is tired of hearing about COVID. They're tired of wearing their masks. They just want this to be over. Our healthcare providers are terribly tired of the whole thing. They're continuing to provide great care to our patients, but they're fatigued, and it's not just COVID. It's the economy and children in school, and there's just so much impact for all of us that I think that we've become accustomed to COVID, and with that we aren't as good as we could be in wearing our masks, making sure we're washing our hands, and in particular the distancing, right? Keeping social distance is so important. And when we so desperately want to gather with our loved ones and we can't, that is so hard. And I think that people are doing it anyway. And I think that's part of the reason why we see these numbers increasing, because people are in a state of desperation. Their mental health requires it. Their overall health requires it, that they see and talk with their loved ones. We just need to do it differently than we used to. We need to do it by phone or by Skype, by text, however we can accomplish it without gathering together.
Yeah. So we are seeing this newest surge, and I just wanted to know how is our hospital responding to it, and what's happening inside our hospital walls right now?
Yeah, the first thing I'll tell you is I'm so proud of our staff. They are facing things that they've never faced before. For example, today we opened up 10 more ICU beds. So we had to move people around. We had to identify different people to help care for these patients that may not have been assigned to do that as of today, but they are today. So I'm so proud of people. I will say that all of our healthcare systems, the University of Iowa and others, are really trying to look at how we deliver care, looking at what the availability space is, making sure that our people are prepared to do what they need to do. But we are in a surge. I guess that's the easiest way to put it. That we have entered into our first phase of our surge plan, and we have the next phase planned, so that we will be able to respond as the need arises.
Yeah, and as you touched on just briefly a little bit ago, I mean, our staff is doing a fantastic job, but they might be burnt out by this too. They don't want to be in this pandemic any more than the public does. So I think it's just good to reiterate that it's not only about protecting yourself or your loved one, it's protecting our frontline workers and making sure that our hospitals don't become overwhelmed, right? And that leads me to my next question is, what happens next to the healthcare system in Iowa if this surge continues? What's at stake here?
Our ability to do surgeries that are even considered essential. So many of us have really decreased those that are elective and in need of beds so that we can conserve our beds for those patients who need a hospital bed, whether it's because of COVID-19 or not. But gradually increasing that threshold means that we won't be doing surgeries that we would have done in a timely way. So that is on the horizon, and many of us have done that already and are considering being more aggressive about that. I think that really important for us to recognize that there are potential for shutdowns. Nobody wants to shut down. We want to continue to do the activities that we do, but if the prevalence of this virus continues as is, and the healthcare resources are so stressed, we have to do something that will decrease the likelihood of people first getting COVID-19 and then subsequently going on to need a hospital bed.
Yeah. So you already touched on a little bit of, we need to not be gathering right now. That's an essential thing. What are some of the other things that are just not safe for us to be doing right now? And if you can also touch on what are some of the things that we can do that are relatively safe? Yeah.
So, interacting with people in your home is safe, right? Doing things like this through Zoom and through technology is safe. And I would encourage you to do more of it, right? I know that within my family, my children and I, we talk on a regular basis, but maybe we should do it more now so that we can keep in contact and try to keep our mental health as stable as it can be in a pandemic. Doing things outside. Now it's cold in Iowa, so it's a little harder to do that, but hopefully we'll have a bit of a reprieve. Sometimes we get some warm weather back, and it's still not that cold to be outside. So anything you can do outside is safer than anything you can do inside. If you have to be with a gathering, it's important to have the number of people be as small as possible. There is a website that was put out, a dashboard put out by Georgia Tech, looking at the risk of you encountering someone in a group gathering with the prevalence in the community. And if you look at Johnson County, and for example, you just say, if I were in a gathering of 15 people, what is the likelihood that at least one person in that gathering would have COVID-19 and be able to give it to the others? That likelihood today in Johnson County, Iowa is 50%. With just a gathering of 15 people. So when you think about going to a restaurant, use takeout. We should definitely be patronizing our local restaurants. We should be, helping them to stay open, but let's do it without gathering together.
Yeah, it's great that so many local places have actually adapted relatively well to the new way of doing things. They've got curbside pickup. You can call in an order and pick it up on the curb, or you can have delivery, which is relatively safe. I've actually gotten to know some of the delivery people who deliver food around here, because that's all we're doing when we get food is we do delivery or we do curbside. And so there are so many options for how to continue doing some of the things we want to do, but safely. I want to ask, what about outdoor gatherings? Is that considered relatively safe if we follow other precautions?
Yeah, again, I would say that outdoors is better than indoors. And part of that's because of the air circulation, right? When you're indoors, we recirculate air. And if you're in a hospital, that recirculation is quite good. If you're not in a hospital, that recirculation is less good. But even outside, you want to respect that 6 feet. And you want to make sure that the gathering is as small as possible, because the more people you have together, the greater the chance that 6 feet of distance will be compromised. And that, as I said, the more people you have, the greater the risk that someone has COVID-19 and doesn't know it.
Yeah, and that's, again, another reason to make sure that everyone is wearing a mask. It only does good if everyone in the gathering has that barrier, correct?
Yes. So even outside, if you're in a group of people, or you are going to a place outside where there are other people, you should be wearing your mask.
Great. What do you think the holidays are going to look like this year? I feel like that's the $1 million question right now.
Different. So I read something the other day that we're not having Christmas this year. Well, of course we're having Christmas this year, right? It's just going to be very different, right? So avoiding gatherings. This is particularly hard for many of us who come from big families or people who live alone. So had a conversation with one of our employees about this not long ago, that, if you live with, your husband or your children, you have a ready-made social network for you. But if you live alone, this is really hard. But gatherings aren't a good idea, period. So figure out how you can do things differently. Make new traditions. We're all going to want to forget 2020, right? But maybe there are new traditions that we can look back and we can celebrate the success that we had, right? The way we got out of this, and think about those when we have new traditions. So bottom line is that holidays need to look different. We have to avoid gathering with each other. Absolutely avoid gathering and eating, because when you eat, you have to remove your mask, and that's when we have seen a lot of transmission in our community.
Yeah, those are all great reminders. I know back in the spring when we were doing this, my family and we did Easter egg coloring virtually. And you know what? It didn't feel weird. We were all still able to talk to each other. It felt obviously the little amount of weird because we weren't together, but we got through it. And I don't think any of us are looking back and going, what a weird thing we did. It was like, well, we got to still be together during a time when we couldn't be together. And so hopefully people can find ways to do that with Thanksgiving and Christmas this year as well. And like you said, maybe we'll look back on it and with fond memories of how creative we got to get through this time.
Yeah, I think there are opportunities. One of the things that my family did at Easter time was there was a fundraiser that had pies. And so we dropped off pies to everyone in our family so that everybody could have pie. We just didn't have it together. We had it separately. I come from a big family, and we have historically got together to bake cookies and candies at Christmas time. And there's always somebody missing, right? Because someone couldn't come. Well, here's an opportunity for us maybe to have those people that couldn't travel for it to be involved in a Zoom cookie making, right?
Exactly.
So I think, a lot of us have really focused on the bad part about COVID-19 and about 2020, but there are some bright things. And, I think to help my mental health and hopefully everyone else's, try to figure out something that is good about it and really magnify that.
Yeah, to quote UI Hospitals and Clinics clinical psychologist Stacey Pollack, we all need to hunt the good right now. We've got to hunt and find that good.
I love that.
What is the latest estimate of when a vaccine will be available for most Iowans? I know we don't have a hard date, but what's the scientific community saying right now?
Yeah, the good news is that we believe that there is a vaccine on the horizon. And I say on the horizon specifically because it is not in hand. There are two leaders, Pfizer and Moderna, both have shared some early preliminary data that their vaccines seem to be 90+% effective. The FDA will review that efficacy data and also the safety data to make sure that these are the right vaccines to put out. I think that important for all of us to not let up on the safety standards gas pedal, right? We need to continue to follow our safety standards because the vaccine, even though it's on the horizon, is not here today. And even if it was here today, it will take a period of time before people get vaccinated. Both of these vaccines require 2 doses. One has to be 3 weeks apart and one is 4 weeks apart. And so the efficacy data is after that second dose. So even if we had it today, even if we were fantastically successful in getting people vaccinated today, we wouldn't see immunity in those first people for at least a month or so, right? So be happy that we have some perhaps light at the end of this tunnel with the vaccines coming, but don't stop your safety standards. We want everyone to be healthy and alive to be able to get these vaccines so that we can go into the new year hopefully rolling out a vaccine campaign. and making sure that we get some herd immunity and hopefully at some point in time, can change things back to maybe near normal. So from a time standpoint, no one knows for sure. It'll probably be at least a couple of weeks before the FDA approves the use of these vaccines, if they approve it. And so there's still some time to go. But hopefully, around the change of the year and into the spring, we'll be able to be vaccinating people.
Yeah, I do want to ask. I'm sure you've heard there's a lot of skepticism out there about whether or not the vaccine will be safe, but we know from the rigorous process of developing a vaccine that it will be safe. And so I've asked all of our experts who have talked with us lately, when it's available, will you be getting the COVID-19 vaccine?
Yes.
Great.
For me, there's no question. I trust that the researchers that have put this forward have done their due diligence to make sure that we are monitoring the safety of it, and the FDA will review that as well. And the other thing I would say is that the average vaccine trial, for the flu shot, for example, which has to undergo a trial every year to see if it's safe and effective, is somewhere between 6,000 and 10,000 people. And these vaccine trials have been far more than that. I think Pfizer is in the 45,000-ish range. So they not only tested the bare minimum people, but they also tested a lot more, and they were very aggressive about trying to include a lot of diversity in those that were enrolled in the study. So if the data shows that it's safe and effective, absolutely, I will take it.
Great. Thanks for answering that question for our audience. If you're just joining us, we're here with Dr. Teresa Brennan, Chief Medical Officer at UI Hospitals and Clinics, and she's answering your questions about COVID-19. So please comment with any questions or concerns, and we'll get to as many as we can throughout the rest of our conversation. So Dr. Brennan, we're going to move on to some of the questions being submitted on Facebook. Linda asks, if someone had COVID-19 in the past, is it safe to be around them now? So I think she means maybe they're past that contagious period. Is it safe to be around them?
Yeah, so it's a really good question. So from the start, there's always been a question of whether someone could get COVID-19 again. And most experts feel that the likelihood of that happening is very, very, very small. But we're not sure that it's zero. There have been some reported cases of people reacquiring the virus, which would mean that they potentially are infectious. They're infectious again. So when someone has recovered from the virus, meaning they have gone out at least 10 days and have had no fever and improvement of symptoms for 3 days, we consider them to not be contagious anymore. They don't need to be isolated anymore. From that point on, we believe they have immunity, but I guess I would say for two reasons it's important for them to continue to mask and you to continue to follow safety standards with them. The one thing is that we don't know if they could get it again. And if they do get it again, you would be at risk. The second is that it's hard to identify those people and say, well, they can't wear a mask or don't have to wear a mask, but everybody else does, right? And so the safest thing is for all of us to continue to follow the safety standards that we know work. Again, wearing your mask, washing your hands, keeping that social distance, and avoiding gatherings. Until we have a vaccine that we have successfully delivered to the majority of the population.
Yeah, and you touched on something that's also important to know. We don't know how likely it is that people could get reinfected. We also don't know how long immunity lasts after someone has the virus. So as you said, it is important to make sure that everyone, regardless if you've had it or not, you wear that mask, you take the precautions, good hand hygiene, social distance. So just wanted to reiterate that point.
Thank you. Yes.
Yeah. Erica on Facebook asks, if people wearing masks are still testing positive, are masks really that effective? I'm not sure if that's what we're seeing, but can you touch on that at all?
Yeah. I mean, for healthcare providers, there are times when a standard medical mask is inadequate for these procedures that we call aerosol generating. That might be when we're putting a tube in someone's breathing tube or when we're giving them a breathing treatment. In those situations, we believe that the virus is more commonly in the air, and then they need more protection. So they may have been wearing a mask, but they weren't wearing the best mask. I think that we feel that the masks are effective. Many people who have become infected, they can pinpoint back to a time when they maybe weren't following safety standards as much as they could. In other situations, it is harder to find when someone got infected. But what we do know, at least looking at our data, that we have lots of people here on campus. And when we have someone who's gotten infected, it's not when they're here because they're wearing their mask religiously here. It may be that they got it at home because someone in their household brought it in. We don't have great solid data that says masks are this effective or more effective than not wearing them, but we do have data, many studies that have shown that masks are better than no mask. Continue to wear your masks.
Yeah, and Dr. Greg Schmidt shared with us a few months ago via one of our Epi Explains videos that masks of all kind are pretty effective in catching the droplets because droplets are from our mouth are typically big enough that they can get trapped in the mask. So that reiterates your point that we do know it's helpful to wear them, and it's even more helpful if both people do source control, people who are together, everybody has their mask on.
Yeah, I would go back to, I made an analogy before about when you drive, right? So when you drive, you follow the speed limit, right? You don't drive when you're intoxicated. You wear your seatbelt. All of those things are designed to keep you safe. And so wearing your mask is really important, but don't forget the other things, right? Don't forget to wash your hands. Don't forget to keep your distance. And really, when we talk about keeping your distance, it's avoiding those social situations, those places where people are gathering together.
Great. Thank you for those reminders. Karen asks, can you explain the term bed counts? She's seen reports of over 2,000 beds available and other reports that hospitals are almost full. So can you kind of explain to people who don't work in a hospital what that means?
Yeah, it's a good question, Karen. And it sounds kind of crazy that we would have 2,000 beds, but yet we're worried about being full. I would say a few things. The first is we have lots of hospitals in Iowa. Some are very small and some are large like we are. Many of the hospitals that are in the kind of medium range to larger range have beds that are not equivalent to each other. So when we talk about a bed count, generally we talk about a count for a specific type of patient, right? So a bed for a pediatric patient is different than a bed for an adult patient. And it's not the size of the bed so much, it's the people that are taking care of them, right? The nursing expertise, the physician expertise to take care of those patients. It's also different in the what we call level of care, how sick the patient is. A bed for an ICU patient, an intensive care patient, someone who's critically ill is different than a bed for someone who just needs an acute bed but aren't critically ill. So when we look at those counts, we look at them by specific type. And it would not surprise me if we have many beds open, they just may not be the right bed. So when our hospitals are talking about being full, historically, at least over this COVID time, we've talked about our ICUs being full and we've talked about our medicine beds being full. We are seeing more admissions in pediatrics actually here over the last several days too. So we'll be watching those pediatric beds quite closely as well. Confusing topic, but really good question.
Yeah, and thank you for explaining that. What kinds of pre-existing health issues put someone at higher risk for COVID-19?
It's a good question, and I'm not sure that we have all the answers, but what we certainly know is advancing age certainly increases the risk. The risk to an 80-year-old is probably far greater than the risk to a 20-year-old. Although, I guess I will step back and say risk is a spectrum, right? Risk isn't like a light switch where you turn it on and you have risk and you turn it off and you have no risk. So even 20-year-olds we've had in the hospital and been even very sick. So the risk changes, but it doesn't mean that the risk in people that don't have these risk factors is zero. I just want to make sure everybody is on the same page there. So advancing age, obesity, diabetes, heart disease, underlying heart and lung disease, high blood pressure, those all have been found to be risk factors. Certainly we know that people who may be taking medications that adjust their immune system, that may put them at risk too. But I would say that what we've seen most commonly here with our patients is it's advancing age, diabetes, and obesity. Those are the three that really seem to be the medical conditions or the demographics of the patient that put them at highest risk for needing to come into the hospital, needing an ICU, and maybe even needing a ventilator.
Thank you. So we've gotten a lot of questions about people wondering with this recent surge if they should cancel their routine medical appointments that they've already got on the books. And what is your advice for people?
Yeah, it's a hard one, right? Because routine is a word that needs more definition. So I would first and foremost always reach out to your healthcare provider. And I can tell you from our standpoint, we may be altering the way we see patients, maybe using more telehealth. We might have to postpone appointments, not because we're worried about patients coming on site, because we have very good safety practices, and I think many hospitals and clinics around the state do as well, but because of the need for people resources. So as we have more patients in the hospital, we need to backfill our nurses and others who, perhaps we have a nurse who was just an inpatient nurse and now transitioned to the outpatient clinic. We're going to pull her back into helping out with the inpatients again as the inpatient numbers rise. So from a routine standpoint, if you have something new or a worsening condition, that is not routine. And you need to make sure that you continue to get medical attention for that. If you have questions about whether your appointment is routine or not, please contact your healthcare provider. Even things like a mammogram, right? If you're a high-risk person or maybe you found a lump, that's not routine. And it may not be routine anyway. So really be cautious about postponing medical care. I think just to think back to the beginning of COVID, we postponed a lot of medical care then. And we in particular saw people coming in with more advanced medical conditions. And nationally, we saw people with more strokes and more heart attacks, and those people were sicker when they came in. So evaluate routine and make sure it truly is routine. Address any questions about whether it's routine with your physician or provider, and use all the resources available. If you can have it done by telemedicine versus coming on site, use the best way to get your care. Don't neglect yourself.
Yeah. Yes, don't neglect your health or your care. And I was hoping you could really quick give our audience a recap of the symptoms of COVID-19, just in case people are experiencing those. We want them to get a telehealth appointment. And so just to remind people, because it is flu season, what are those symptoms we want people to get seek attention for?
Yeah, so there's a lot of symptoms that could be COVID-19. So I think the first thing is to have a high degree of suspicion. If you have new symptoms. The big things are fever. In general, in the first several days, people might not notice breathing troubles or cough, but those two would be symptoms. Certainly muscle aches, headache, fatigue, sore throat, nasal congestion, those sorts of kind of things that we consider to be very consistent with other coronaviruses that cause the common cold. Those should always prompt people to think about COVID-19. Loss of smell and taste is one of those that is a very unusual symptom, and we see more commonly with patients with COVID-19. So new symptoms that are unexplained are consistent with kind of a viral infection. We should always be thinking about it. The good news, you pointed out influenza. The good news is we haven't really seen much influenza. And that has been our hope and prayer that would actually be what happened. We still have a lot of time to go in influenza season. But washing your hands, wearing your mask, keeping distance, those are the same things we would do to decrease the risk of influenza transmission. So we're very hopeful that we will not have a bad influenza season because that will stress the healthcare system and make people sick.
Yeah. Is it too late for people to get their influenza vaccine, or is that something people can still do this year?
For sure. Yes. If you haven't gotten your vaccine, get it. The one caveat that we've talked about is that the COVID vaccines may require you to have a period of time after getting another vaccine before you can get the COVID vaccine. So for both of the reasons of get your vaccine so that you can stay healthy, as well as be ready for the COVID vaccine when it comes, get your vaccine early.
That's a great reminder. Thank you for mentioning that piece. We're pretty much out of time today, so I just wanted to see if there's anything else you wanted to leave our audience with today, Dr. Brennan.
Yeah, I mean, the only thing I would say is we need to take care of each other. We need to watch out for ourselves and our family and our fellow Iowans. And I would just make a plea to you to please follow the safety standards. We are close. And when I mean close, I think there's a light at the end of this tunnel. It's probably going to be a few more months, but we can hopefully see the end coming. But it really relies on us, each individually, to make an effort to wear your mask, avoid social gatherings, and if you're in a place where other people, keep that social distance and wash your hands. We can get through this, and we will. We will get back to a place where, it'll be close to normal or maybe a different normal, but we can get out of this. But it takes each and every one of us to make a commitment that we're going to do what is right and what is safe. So thanks for all you're doing out there. I know that lots of you are doing lots of great things. We really appreciate it, and all the kind words and support you've given to our healthcare providers are amazing. So we really appreciate your help, but we need you now more than ever to really follow all those safety standards.
Well, thank you so much for providing your expertise and for that little bit of encouragement and positivity, Dr. Brennan.
You bet. Stay safe.
And thanks. You too. And thank you to everyone who tuned in. If you joined us after we started, please make sure to go back to the very beginning of the broadcast to hear all of the great information Dr. Brennan provided to us today. And stay tuned to our social media accounts and our website, uihc.org, for all of the latest information on COVID-19 as we have it. Lastly, practice your Iowa Nice. Wear your mask, wash your hands, avoid enclosed spaces, and find virtual ways to celebrate with people, and take care of yourself and your family. Thanks for watching.